Assalamualaikum warahmatullahi wabarakatuh. My name is Muhamad Aiman bin Muhamad Zaidi, metric number 1720027. Today, I will be presenting about injuries in volleyball. First, we need to define what is injuries, specifically sport injuries. Sport injuries by definition is any injuries that occurs when engaging in sports activities or exercises. There are many causes to these sport injuries, such as overtraining, lack of conditioning, and also improper execution of certain techniques in certain sports. Not warming up also can contribute to the sports injuries and increase its chances. Next, we will talk about the type of sport injuries. There are three types of sport injuries. The first one, which is the acute. The second one, which is overuse, and the third one, which is chronic. Acute type of injuries, which is happen only in a single event that can last for 5 days. These injuries usually is a common one and has a small effects on the performance. It can be cured easily. The overuse one is kind of hard to be detected because it's happening because of overtraining or overuse of the muscles for such a long period of time. So overuse can be happening in the later period, in the later age, and can sustain a very long-lasting injuries. And the last one, which is the chronic one, usually happen involving a certain rupture or heavily damaged muscles or bones, which can last even for months and years. These chronic types of sport injuries are usually happen due to accidents during the engagement of sport. Next, we will discuss about injuries in volleyball. I will explain 7 injuries that happen in volleyball. The first one, which is ankle sprain and strain. Ankle sprain and strain is the most common one in volleyball injuries, and it can happen to the most of the volleyball players. This is due to the active movement during the volleyball games, in which volleyball players do some jumping and also sidestepping. This also occurred during the spiking and also blocking, in which the feet landing on the different position, especially landing on other players' feet or landing awkwardly on the ground, which resulted in the ankle sprain. Okay, we need to differentiate between the sprain and also the strain. The sprain is happen due to the overstretch or torn in the part of the ligament. Ligament is the tissue that connected between two bones. As for strain, which is the overstretch or torn of the tendon or muscles, which the fibrous tissue that connected the muscle to the bone. Okay, this is the common injuries that happen, which is the ankle sprain and strain in the volleyballs. Next, the second common injury is in volleyball, which is concussion. Concussion is an injury happen to the head, in which the head being hit or being blown from any direction and also from any forces, external forces. In this case, in the volleyball situation, the volleyball players may experience concussion after being hit by the ball itself to the head, or by other players if they are overstretched or their movement somehow prevented you in a certain position which hit you in the head, and also if you fall during the spiking or blocking, especially on the sports equipment on the volleyball court, such as net and also the steel pole. So all of these causes can contribute to the concussion, and which is happen commonly in the volleyball games. Okay, next, the third one, which is knee injuries. There are 2 types of knee injuries that happen in the volleyball. The first one, which is jumpers or patella tendonitis, and the second one, which is ACL, anterior cruciate ligaments. The first one, which is jumpers, happen because the overuse usage of the knees and feet during the volleyball session, in which when the players jump on the repetitive motion will cause the patella tendon or the knee tendon to have a tears or overstretch, which will cause these injuries. And another cause of these injuries, the jump size, is the explosive jump or the sudden jump, which led to the muscle not prepared to have the impact of stretching. As for ACL, anterior cruciate ligaments, which is a rare case happen in the volleyball, rare injuries that happen in the volleyball, when it was caused due to the jumping and landed awkwardly, will later led to the pop sound, which happened on the knees. This can cause a very serious injuries, a chronic one, and will prevent the players to play further. And now we will go to the fourth one, which is the last one on the lower injuries, lower body part injuries, which is the low back pain. The low back pain is a chronic type of the injuries which happen to the most common of the volleyball players. The cause of this due to the muscle or ligament strains that happen on our back due to the repetitive action and position during the volleyball plays, like when we are jumping, we are jumping for the spiking and also for the blocking, and also due to the strenuous training regime, which can also cause this pain. If the pain happen and not have experienced radiating pain, this can be caused only just due to the strain. However, if the pain experience a radiating pain, this will due to the cause of a herniatic disc and need a further treatment by the medical professional in order to prevent it to become more worse. Next, the fifth one, which is one of the first of the upper body injuries, which is the shoulder injuries. Shoulder injuries have two types. First one is rotator cuff tendonitis, and the second one is shoulder impingement. For rotator cuff tendonitis happen because of the repetition action of moving your shoulders during serve, spiking, and also blocking. This constant repetitive will develop soreness and pain to our shoulders, and overuse of the muscle led to the tears and overstretch of the muscle tendon on the shoulder. As for the shoulder impingement, basically happen mostly for the younger players, which is due to it will caused by the pain experienced by the pain on the same part, and the symptoms are quite similar to the rotator cuff tendonitis. As for the shoulder impingement, further inspection by the medical professionals are needed because as it occurs in the younger players, it may cause a future risk or future injuries if not be treated. Last but not least, which is the sixth one, the fingers injuries. The fingers injuries, which often occur during blocking and serving or setting, or also during the digging. These injuries can be varied in the circumstances because it can be caused by different action. It can be resulted in the fractures of the bone, dislocation, and the tears in the ligament and tendon. So the treatment for these finger injuries is very dependent on which situation or which injuries, fingers injuries that the volleyball players experience. In conclusion, this is all most common injuries that happen in the volleyball, and of all of these injuries are due to the overuse or overtraining of the certain specific muscles. Later will cause the muscle soreness and muscle strain and lead to the injuries. And the injuries can be classified as the ankle sprain, concussion, shoulder injuries, knee injuries, and fingers injuries. The common treatment of most of these injuries are the RICE treatment: R, rest, I, ice, C, compression, and E, elevation. And also, to prevent all the injuries, commonly we need to, during the warm-up and cooling down session, before and after the session. And also to have a proper training and exercise in order to solidify or strengthen a specific part which the injuries mostly occur. And lastly, to execute the proper form or the correct form of the technique in order to avoid any risky injuries or risky movement that will lead to a serious injuries. I think that's all for me. Thank you.